Hi, Dr. McAllister. How are you today?
I'm doing well. Thanks for having me on, Brett.
Well, thank you for coming on the program. Now, how serious is something like chronic migraine? Is this something that a lot of people deal with, or is this something that it's not terribly common, but it's becoming more common?
Well, I've got some really big numbers for you. I mean, this is a condition that affects about 18% of all women, that is migraine itself, and about 6% of men. So we're talking 36 million people in this country have migraine, and of that group, about 3.2 million people are estimated to have chronic migraine, which is 15 or more headache days per month, each lasting more than 4 hours, and about half of those headaches having migrainous symptoms such as light and sound sensitivity, nausea or vomiting, concentration difficulties, dizziness. So, while I tell my patients, well, nobody dies of migraine, the disability, that is missing out on life from migraine, and particularly chronic migraine, the 15 or more headaches, is just profound.
Well, for those who are like me and they've never had a migraine, what does it feel like? How do they know the difference between a migraine and a headache?
So that's a good question. Most of us in this country, over 90%, have had a headache, which we call tension headache, and we don't consider that a medical condition. Migraine is different. So migraine is a genetically inherited brain disorder, a neurological disorder, and there's so many symptoms other than just the pain. And by the way, the pain isn't mild to moderate like a regular headache. It's usually severe. But there's mental slowing, concentration difficulties, throwing up, sensitivity to smells and sounds and lights. And then even after the whole pain passes, patients are left for a day or two feeling just wiped out emotionally and physically. And you could imagine if you had 2 or 3 or 4 of these a month, why that would really begin to impact the quality of your life. What I see a lot in my headache center, the chronic migraineurs, they're cycling through this 15, 18, 23 times a month. I mean, it's very hard to hold down a job. It's very hard to take care of kids. It's hard to keep the family functioning, and it's also hard to have a social life.
Is this something where they are pretty much lying in bed in pain when it happens?
Right, so picture the shades drawn down, the room quiet, the patient with her head under the pillow. She's feeling nauseous. She can't move. Someone else has to take care of the family for that day, or she's calling in to her boss for the 2nd, 3rd, or 10th time that month. That gives you an idea of what these patients are suffering from.
Wow, I mean, and it sounds like it definitely is something that your life becomes very unstable because, with jobs, but the employer doesn't know if the person wants the job, if this is an excuse, or if they can handle that job.
Right. I can't tell you how many of my patients are wonderful at their job. They just keep calling in sick. They don't want to. And sometimes they struggle to get in because they have to. And we don't call that absenteeism. We call it presenteeism. That means you show up at work, but you're just so shot. You've kind of got your head down at your workstation, and you're really not doing much of anything.
Now, is this something that a lot of doctors can easily diagnose, or is it something that often is misdiagnosed and therefore the wrong treatment ends up being given?
That's a great question, and the fact is that many migraine sufferers are either not diagnosed or misdiagnosed. For example, some people are told they've got chronic sinus headaches. Some people with migraine have a stuffy sensation in their nose and their eye, and so the doctor, often primary care doctor, thinks we're dealing with sinus headache. Needing your glasses prescription changed is another cause. So there are misdiagnoses and underdiagnoses, and it gets worse when we're talking about this group that has 15 or more headaches per month, the chronic migraine group. There was a large study showing that perhaps 80% of people who have chronic migraine have not received that diagnosis by their healthcare provider. And what's the problem there? Well, they're generally trying to seek treatment themselves. They're using over-the-counter medications that can wind up causing stomach and liver and kidney trouble, etc., and they're not getting access to medications that would be more useful. For example, the only drug that's FDA approved for the treatment of chronic migraines is Botox. And if you haven't made the diagnosis of chronic migraine, you're not going to even know that that exists or be offered it.
Well, for those people who are misdiagnosed, what are some ways to avoid that?
Well, I think, your radio show, Brent, is doing a public service. I think getting the word out and educating people that they don't have to suffer. I think that, if someone had chest pain, they generally don't try to treat it themselves. They go to an emergency department. But because headaches, the milder, not migraine, but regular headaches, are just part and parcel of life, many people mistakenly think, well, I just have to suffer from this. And there have been many even, actors and producers and a lot of famous folks who for years didn't even know they had migraine or chronic migraine. And then when they write about it, they say, boy, I was struggling through my career trying to treat all these headaches and just suffering. Education is the key to getting them in to see a migraine specialist or a neurologist, and then they can discuss how to treat, which includes lifestyle changes and then medications.
Okay. Well, where can people go to find out more information about chronic migraines, and then that way, if they feel that they are someone that suffers from it, they can get to their doctor as soon as possible?
Sure. So a good website that talks about migraine and chronic migraine, and then the use of Botox to treat chronic migraine, is a website that's called BotoxChronicMigraine.com. And they can go on there, learn about chronic migraine, what it is, learn about Botox and how we discovered its use for chronic migraine. And they could even put their zip code in, and they can find migraine and headache specialists in their area.
Well, that's definitely very helpful. And thank you for coming on the program. It's been a pleasure talking with you, Dr. McAllister.
Thank you for having me, Bryn.
Have a great day.
Okay, bye-bye.
Bye.